Thank you. Please kindly be seated, please. I'd like to welcome everyone to the 405th inaugural lecture of this great institution titled Beyond Counting, Pouring and Sticking, Managing Pharmacy Operation for Quality Service. This is to be presented by Professor Margaret Olubunmi Afolabi. Professor Margaret Olubunmi Afolabi is a professor of pharmacy administration by God's grace. She was born over 6 decades ago, and she graduated as a pharmacist from the University of Benin in 1979. She obtained postgraduate qualifications, MSc Pharmaceutics, MBA, MPhil, and PhD from Obafemi University, this great institution. Professor Olubunmi Afolabi worked for 3 years as a hospital pharmacist before she joined the services of Obafemi University in 1982. She was promoted to the rank of professor in October 2013. She has served in different institutions, both within and outside the country. She has served as visiting lecturer to the Faculty of Pharmacy, University of Ibadan, Nigeria, external examiner and peer reviewer to many faculties of pharmacy in Nigeria, as visiting lecturer in pharmacy and business education at the University College of Belize, Central America, and was appointed as a professor and WHO consultant to the College of Medicine and Allied Health Sciences, University of Sierra Leone, Freetown. She has successfully authored and supervised many research theses, technical reports, and over 40 published papers in reputable academic journals, in addition to chapter contributions to 8 published books in her discipline. She has attended several academic and professional conferences, both in Nigeria and abroad. She also attended executive training programs at the University of Washington, Seattle, in Montreal, Canada, at Harvard Business School, Boston, and at the Business School for the World, Fontainebleau, France. She's currently a fellow of the IWF Leadership Foundation, an elected fellow of West African Postgraduate College of Pharmacists, and a merit award winner of Osun State PSN. Yeah. She holds a certificate of proficiency in cyber security. She's a regular trainer at the West African Postgraduate College of Pharmacists and the mandatory continuing professional development program for pharmacists in Nigeria and in Sierra Leone. Professor Olubunmi Afolabi has also served in several administrative positions in the university as acting head of department, vice dean, and substantive dean of Faculty of Pharmacy, and as a member of the University Senate. Mr. Afolabi is an active member and a resource person of the Pharmaceutical Society of Nigeria, Association of Lady Pharmacists, and a member of Nigerian Association of Pharmacists in Academia. She served for many years as the treasurer of KUFAM and chairperson of Campus Pharmacy, a business outfit of PSN, Osun State. She also belongs to the Pharmaceutical Society of Sierra Leone and a member of American College of Healthcare Executives. Professor Olubunmi Afolabi is actively involved in Christian and community services. She is a regular presenter of the program, Hour of Praise, on Crown FM 101.5 Ile-Ife. Director of Bethany Foundation, an NGO initiative based in Nigeria, established to support the needs of women, youth, and the less privileged. She is happily married with children and grandchildren. I have the singular honor of presenting to you Professor Olubunmi Afolabi to deliver a lecture. Thank you.
Awolowo University, Ile-Ife. The inaugural lecture is titled Beyond Canteen, Pouring, and Sticking, Managing Pharmacy Operations for Quality Service. This is the second inaugural lecture in the field of pharmacy administration from the Department of Clinical Pharmacy and Pharmacy Administration. And I'm deeply grateful to God for the privilege of standing before you today to deliver the lecture. It's such a great opportunity, which I do not take for granted. Permit me to start my lecture with this reflecting verse from the Bible. Oh Lord, I know that the path of a man is not in himself. It is not within the limited ability of man, even one at his best, to choose and direct his steps in life. Jeremiah chapter 10, verse 23. This inspired statement underpins my fortuitous journey into academics and my odyssey in pharmacy administration. I was admitted to a 5-year pharmacy program at the University of Benin, Benin City, Nigeria. And I graduated with B.Pharm Honors degree in 1979. As a young academic enthusiast, I joined the Faculty of Pharmacy of the then University of Ife, now Obafemi Awolowo University, in 1982, after a 3-year work experience as a hospital pharmacist. I obtained MSc Pharmaceutics in 1984, but was stuck in an academic procedural limbo for a while due to lack of staff on the ground to supervise my PhD program in tableting technology at the faculty. As an academic on the staff list, and having waited on end with no prospect of moving ahead on my career trajectory, I registered for MBA program in the Faculty of Administration. And this ignited my interest and enhanced the competence to teach pharmacy administration courses, a significant and compulsory component of pharmacy curriculum in the faculty. This marked a watershed in my career path, and I resolved to launch fully into pharmacy administration as a discipline. In a bid to get grounded in this social and administrative component of pharmacy, I enrolled for relevant programs in 3 other faculties within this university. Thus, apart from the MBA, I obtained another postgraduate degree MPhil in the Faculty of Administration, MPH in the Faculty of Clinical Sciences, and PhD in the Faculty of Technology. My academic sojourn in this great citadel of learning and the quest for knowledge to advance my career led me to engage in relevant faculties of the university, where I obtained 5 postgraduate qualifications. Not for mere adventure, but an endeavor to acquire the necessary skills to confidently chart the path and demands of the new discipline of pharmacy administration in Nigeria. Mr. Vice Chancellor, sir, I am pleased to announce that eventually I became the first female professor of pharmacy administration in West Africa. Moreover, to date, this is the only university in Nigeria where pharmacy administration as a subdiscipline of pharmacy is taught up to the PhD level. My deep appreciation goes to Professor Wilson Ero, who blazed the trail as the first professor of pharmacy administration, for his vision and doggedness in working assiduously to get the program approved. I'm glad to be a part of this success story. Furthermore, I'm privileged to have been able to demonstrate the robustness of pharmacy training and its multifaceted boundary relations with other significant disciplines in the university. Social and administrative pharmacy is used loosely to describe a collection of pharmacy different interests, which outline the social aspect of pharmacy, sometimes labeled social pharmacy, administrative pharmacy, or pharmacy administration. The broad discipline is founded on the principles of social sciences and organizational theory, emphasizing the beliefs, values, and behaviors that people display in relation to medicine use and ill health. Hospital pharmacy practice appears to be the most visible area of the profession, with dispensing activities being the hallmark of gauging the pharmacist's relevance in healthcare. Now to the question, are pharmacists stuck, canting, pouring, and sticking? This is a metaphorical expression to describe the extrinsic activities involved in dispensing prescriptions to a patient, canting the pills, pouring liquid dosage form, and sticking a label to the container. However, there is more to the training and professional competence of a pharmacist as an invaluable healthcare professional. The desire to explore innovative strategies to improve pharmacy operations in a bid to incorporate other patient care activities and public health initiatives into the basic dispensing functions informed my research activities in pharmacy administration for almost 40 years. My main research focus has been on enhancing pharmacy practice both in the hospital and the community. Mr. Vice Chancellor, sir, it will be relevant to say a word on the extended role of pharmacists in healthcare services. Pharmacy profession has evolved from the conventional and traditional product-focused approach to an extended patient-focused care over the years. Pharmacists get involved in patient care and public health in a proactive way, going far beyond the stereotypical canting, pouring, and sticking of prescription drugs. The pharmacist's extended role not only helps to enhance the quality of patient care, but also saves money by addressing medication-related problems before they escalate. Administration is a work of managing an organization's resources and various assets. Pharmacy administration as a subspecialty provides an in-depth knowledge of the principles and practice of pharmacy in advancing human health and the health systems, in addition to a deep understanding of critical business and analytical skills. Pharmacy administration draws knowledge from other disciplines, hence the need for me to venture into some other faculties, mostly from the management sciences, sociology, and psychology. My research activities in pharmacy administration may be categorized into 4 main areas: operations management of hospital pharmacies, effective use of technology in pharmacy operations, pharmaceutical services in public health, and enhancing service quality in community pharmacies. Operations management of pharmacies is a discipline of management that integrates scientific or quantitative principles to determine the most efficient and optimal methods for pharmaceutical services in patient care. In examining operations management of pharmacies, therefore, I dabble into evaluating patient queues in the hospitals. Pharmacy administration is applied science, and as such, studies in the field grow from practical problems experienced in concrete social reality. For instance, in Nigeria hospitals, patients physically wait in lines. They queue up to fill their prescriptions at the pharmacies. This observation, particularly when I was a hospital pharmacist, informed my investigation of dispensing procedure and identification of possible operational problems that may lead to excessive patient waiting time at the pharmacies. The subcomponents of a typical outpatient dispensing process are presented in Table 1. Long waiting line has been given as a reason why some patients did not fill their prescriptions in some hospitals. Therefore, it becomes imperative to carry out a systematic study on patient waiting times in hospitals. To this end, Afolabi and Aaron, 2003, Afolabi et al. 2010 investigated exhaustively the procedural problems in dispensing in the hospital pharmacies. Figures 1A and 1B, tables 2 and 3, and figure 2. They give a concise description of the various processes and delays that patients experience when they go to fill their prescriptions in the pharmacies. Table 2 shows that most of the patient waiting time was due to delay. In fact, we computed that 75% of the time patients spent in the pharmacy are due to delay, with only about 4 minutes due to the processing of the dispensing itself. Restructuring the pharmacy layout appropriately to reduce movement will lead to a reduction in the total patient waiting time. We carried out a similar study in other universities, hospitals, Ladoke Akintola University Teaching Hospital, and University College Hospital at Ibadan. At these hospitals, patients were attended to directly by the pharmacist without the mediation of attendants. However, major delays were observed even at the cashier point. In view of this finding, therefore, I decided to use certain scientific tools to model dispensing procedures using the queuing theory. Afolabi et al. 2010 presented a redesign of the work system and provided quantitative data relevant to improving dispensing operations in the pharmacies. The queuing models were used to characterize patient waiting time to simulate optimal capacity utilization for the service channels at the dispensing counter. Our findings show that the existing service channels of 4 gave only utilization factor of about 8%. My redesign showed that with 2 service channels, this could be improved to 66%. Similar simulations were done for waiting lines at the cashier's counters. That's what is presented in table 4B. Using the queuing theory, therefore, we only needed the mean arrival rate, which is a lambda, and the mean service rate, which is a mu. So I used this scientific knowledge to compute the design. Considerable delays were observed in dispensing to outpatients in the 3 hospital pharmacies investigated. Design thinking recognizes the service provider. In this regard, therefore, Afolabi et al. 2009 investigated the views of hospital pharmacists on the adequacy of the content and design of their work environment. The result is presented in table 5, and we further assessed their level of job satisfaction. The challenges identified in the work system were in the areas of inappropriate structural amenities, staff welfare, and the process of service delivery. Shortage of staff pharmacists and patient delays were of serious concern. In a previous study, Afolabi 1999, we examined the level of job satisfaction of this hospital pharmacist in Nigeria, and results showed general dissatisfaction among the pharmacists in this practice setting. Applying various motivational theories, Olubunmi and Afolabi identified job-related factors which are of significance to practicing pharmacists. The study examined the concept of motivation with emphasis on the relevance of intrinsic and extrinsic motivational factors as suggested by Hesber's 2-factor theory. We went ahead to examine the perspectives of patrons on the performance of pharmacists' activities in the hospitals. In this regard, we investigated the nurses and the physicians. Afolabi et al. 2009 examined interprofessional perspectives of physicians and nurses on pharmacist activities. using the pharmacist practice activity classification document designed in the United States. The result is presented in Table 6. The two professional groups, they showed concordance in the perceived order of importance of pharmacist activities. There was a significant difference in their ratings of pharmacists' influence of prescribing and medicine use. Further on, we tried to evaluate the perspectives of patients as consumers of the services of this pharmacist. Afolabi, 1999, examined patient satisfaction with this pharmacist's activities. The results showed that patients were generally satisfied with the services at the pharmacy. The specific aspects of satisfaction include ready availability of most prescribed medicines, 24-hour service, and the assurance of quality medicines. However, the major dissatisfaction was the long patient waiting time. And most patients wished for a more convenient waiting area. I'm glad to say that since the study, at least a temporary conducive waiting area has been provided for the patients at the hospital. In another study on patrons' perspectives, Afolabi and Osemene of blessed memory, 2021, examined consumer satisfaction with healthcare services provided by community pharmacists in Sierra Leone. Provision of health information and the quality of available medicines were highly satisfactory, while promptness of service delivery and stock level earned moderate scores. The patrons frowned at occasional absence of pharmacists from their premises. On issues relevant to quality improvement of pharmaceutical services, I collaborated with Ihekoroye in Ihekoroye et al. 2021, and we explored customer perspectives using indicators drawn from service quality domains of reliability, assurance, tangibles, equity, and responsiveness. Significant gaps were observed in customer expectations of responsiveness, reliability of service teams, and service fulfillment. These findings underscore the need to prioritize customer satisfaction, serving them promptly, correctly, and as promised, because it's generally said that the customer is king. Furthermore, I ventured into designing an instrument to measure patient satisfaction with pharmaceutical services in Nigeria hospitals. In my quest to present this patient satisfaction as a measure of pharmacist performance, Afolabi et al. 2012 developed this instrument using an initial questionnaire of 35-item inventory titled Patient Satisfaction Survey. Eventually, we reduced the final to 25-item PSS scale. And this yielded 6-factor components reflecting key dimensions of pharmacy services perceived as important by patients. The 6 factors with eigenvalue greater than 1 are attitude of pharmacy personnel, accessibility and convenience of pharmacy location, quality and cost of the medicines, conducive patient waiting area, availability of prescribed medicines, and promptness of service delivery, presented in Table 7. Essentially, the scale was found to be psychometrically valid to measure patient satisfaction and could be used to improve service in the pharmacies. We all have come across the medicine information leaflets enclosed in medication packages. We felt there is a need for us to evaluate how usable do patients or consumers find these medicine information leaflets. We therefore considered the usability, the readability, and the comprehension. It's supposed to be a product to complement and to assist the consumers in their medicine use. Afolabi et al. 2010 developed an instrument to estimate the readability and content validity of 5 selected anti-malaria medicine packages. MILs are documents that provide important information about a medication. Furthermore, Titus Afolabi and Olorun 2020 assess the adequacy of information contained in medicine information leaflets in terms of the content validity and sequence based on guidelines in the summary product characteristics of NAFDAC. I employed the gun-informed formula, and we went on further to also use the SPC of NAFDAC. And furthermore, in 2022, Titus Afolabi and Olorun explored the use of 2 other tools in evaluating how useful these medicine information leaflets are. And then we use the Flesch-Kincaid formula and the Baker-Abel leaflet design assessment tool. Summarily, a large proportion of the medicine information leaflets were poorly designed and written above the reading level of average consumers of these over-the-counter products. These studies concluded that content validity of medicine information leaflets in some over-the-counter medicines was suboptimal, thus recommending stricter enforcement to ensure full compliance with NAFDAC specifications. Application of digital technology in pharmacy operations. In order to decrease pharmacists' workload while maintaining or increasing efficiency and productivity, the input of information technology and automation is integral. Afolabi and OABC 2007 examined the attitude of pharmacists to the introduction of automated techniques in the delivery of pharmaceutical services in Nigeria hospitals. The findings show that they view the technological innovation as an enabler for re-engineering pharmacy practice. In a bid to further demonstrate a homegrown quality improvement solution for hospital pharmacy operations, Afolabi et al. 2018 developed a web-based software for prescription monitoring and medicine management. This was deployed for use at the university healthcare facility with so many different modules. It is gratifying to note that the inventory management module of the software was deployed successfully at the pharmacy unit of the university healthcare facility. This instrument we call the Pharma Portal. Automation has the potential to achieve many qualitative changes in how organizations and groups of people work and interact. Vocal discussions about technological unemployment argue that automation does not only cause job loss, but also impairs the quality of existing jobs by subjecting work to the control of and rhythm of the machine. Afolabi and OABC 2007 explored this view in a study on pharmacists' perception of barriers to automation in hospital pharmacies. The other possible barriers highlighted were the large capital outlay required, the dearth of skilled manpower, inadequate infrastructural facilities, and poor management commitment. In recognition of the strategic role of service providers, Afolabi and Olorun 2013 examined the subject of managing pharmacy operations with people and technology. The paper highlighted the essence of technology in pharmacy operations and examined the human resource issues. The findings were published as a chapter contribution in an online book titled Engineering Management. To date, this book chapter has the highest download of 6,773 by viewers, followed only by another chapter in modeling and linear programming with a download of 5,447. Medicine optimization is a person-centered approach to safe and effective use of medicines to ensure that people obtain the best possible outcomes from their medicines. This is of essence in the management of long term illnesses. Adherence to medication in chronic illnesses may be facilitated by technology, and this plays an integral role in connecting all stakeholders. Afolabi et al. 2008 examined pharmacists' use of mobile telephony to monitor patient adherence to antiretroviral therapy among HIV/AIDS patients at a university teaching hospital. In a similar study, Olubunmi Afolabi et al. 2014 explore medicine information needs of medical outpatients at the cardiac care unit of a university teaching hospital. Furthermore, Adeshokun et al. 2024 examined the effect of mobile telephony on medication adherence among patients with type 2 diabetes. The findings of these studies showed an improvement in patient adherence to medications and clinic attendance. These interventions emphasized the significance of pharmacists' extended role in patient therapeutic outcome, but facilitated by technological innovations beyond counting, pouring, and sticking. Patient medication counseling is a pharmaceutical care service targeted at optimizing medicine use, medication safety, and improved treatment outcomes. In the study on the use of online patient counseling in pharmacy practice, there was an emphasis on the qualities of this innovative counseling technique in the care of chronically ill and stigmatized patients living with HIV/AIDS. Afolabi et al. 2012. The attractive qualities of this model, including unfettered access and anonymity, which hold more promise for care outreach to individuals living with HIV/AIDS. I collaborated in some other studies which demonstrated the positive effect of integrating digital technologies as an enabling factor in healthcare delivery. And these were presented in Inaugural et al. 2007 and 2012. Major challenges to effective adoption of ICT included inadequate infrastructural facilities, human factors, and poor management commitment. Much as the relevant technologies facilitate effective healthcare service delivery, the level of adoption varies among practitioners, and this response may limit the expected benefit considerably. In a study on the level of adoption of the mini-lab, one of the novel technologies, Olubunmi Afolabi and OABC 2015 showed that the adoption level was very low among hospital pharmacists. The mini-lab is a mobile quality assessment technology for use in developing countries to detect spurious medicines in the pharmaceutical distribution chain. Similarly, Olubunmi OABC and Afolabi 2022 evaluated the readiness of community pharmacies to embrace e-pharmacy in their operations. The findings showed a prevalence of negative attitude towards this proposed change. Pharmaceutical public health highlights pharmacists' contribution to the delivery of public health at the policy, strategic, and service levels. Their role in all issues where there is a pharmaceutical dimension, such as vaccinations, public health emergencies, medicine procurement processes, medication use, and health promotions. My studies in the following areas demonstrated the extended role of pharmacists in public health beyond product dispensing. In a publication on patient therapy and drug control in healthcare organization, Afolabi 2004 examined drug utilization studies or drug monitoring program as possible strategies in a quality assurance framework. In the quest for ways to ensure improved access to health and quality of care, Afolabi et al. 2013 examined consumer healthcare behavior using the template of student environment in a university. The findings showed that students sought care from community pharmacies for ease of access, and from their peers in health-related academic programs, rather than from physicians at the healthcare facility. Their health-seeking behavior was influenced by the nature of the ailment and the waiting time and the attitude of healthcare professionals. Pharmaceutical waste continued to be a new frontier in environmental management for healthcare facilities and a strong issue of public health concern. Odewale and Afolabi 2019 examined the management of pharmaceutical waste in 4 healthcare facilities in Lagos metropolis. The study showed that none of the facilities had clear policies or plans in place for managing pharmaceutical waste, as evidenced by the absence of manuals and guidelines, in addition to poor compliance with recommended waste management practices prescribed by the WHO. I'm currently involved in a team project on take-back strategies to manage pharmaceutical waste and prevent indiscriminate disposal into the ecosystem. This project, tagged PharmaBeing, is designed to involve relevant stakeholders, including community pharmacies, to foster green pharmacy and pharmacovigilance. Reporting ADR is an integral part of pharmacists' activities in monitoring the use of medicines. Osemene Ayeni and Afolabi 2012 examined common types of ADRs detected and reported by community pharmacies in Nigeria. The results of the study showed that the involvement of pharmacists was considerably low. In a similar study conducted in practicing pharmacy professionals in Sierra Leone, Afolabi, Osemene, and Kome 2015 sought to determine the respondents' knowledge, attitude, and practices in reporting ADRs. Our findings revealed some knowledge gaps among the professionals in monitoring and reporting ADR. Some forms of traditional medicine are used by a significant proportion of the Nigerian population for reasons of culture, tradition, affordability, and accessibility. Traditional medicine practitioners, TMP, are the main purveyors of these remedies. Adequity, Agbaje, and Afolabi 2021 engaged a considerable number of traditional medicine practitioners from Ilesha and Ile-Ife in Osun State. The list of selected herbs were examined to assess their knowledge of the indications and possible interactions. Results of our study showed that the respondents had some knowledge of herb interactions, and they remarked that ficus, one of the herbs, had no effect on anti-malaria activities of the other herbs we considered. This view agreed with empirical studies on anti-malaria properties of the herbs using the chemosuppressive test model. Post-marketing surveillance of medicines is important in order to monitor other emerging adverse effects of medicines already in use. Osemene and Afolabi 2017 conducted a cross-sectional survey among final year pharmacy students in 3 Nigerian universities to assess their knowledge of pharmacovigilance. The study revealed inadequate knowledge, and we therefore recommended that this should be incorporated and emphasized in the curriculum. Family planning is an important aspect of socio-economic development, for which access to contraceptive commodities by users is critical. Unfortunately, the availability of these commodities is usually compromised in most developing countries. Olonode, Afolabi, and Olorun 2016 designed a study to assess the availability of contraceptives in Osun State. The availability of contraceptive commodities was optimal at the state central warehouse, but suboptimal at the service delivery points. This portends grave implications for the attainment of contraceptive security. Studies on psychoactive drugs use among adolescents in Nigeria have indicated and emerging problems of public health concern. Afolabi et al. 2012 identified a number of hard drugs used for various reasons by adolescents in some secondary schools in Ile-Ife. The study showed a high frequency of psychoactive drug use among the students. Misuse of antimicrobial medicines is a major contributory factor to the development of resistant strains of microorganisms, therapeutic failure, and increased healthcare costs in many countries. Afolabi et al. 2014 examined the pattern of antimicrobial use among undergraduate students at the University of Sierra Leone and determined possible gaps in their understanding of appropriate use. The study showed there was unrestricted use of prescription medicines among these students. Hosseini and Afolabi 2018 appraised the knowledge and involvement of community pharmacists in health promotion services in Oyo State. Only a few of the respondents demonstrated knowledge of these services, but they were willing to get trained. So further on, we organized a training program for them. Hosseini and Afolabi 2020 developed and evaluated the relevant training program for the pharmacist. So in a longitudinal study thereafter, Hosseini and Afolabi evaluated the level of involvement of this pharmacist after the training. The study concluded that the community pharmacists demonstrated favorable attitude towards health promotion with notable improvements in the services they offered after the training in health promotion activities. In a bid to address the challenges of high cost and shortage of medicines in public hospitals, the Nigerian government set up a drug revolving fund scheme in 1988 on the creation of the National Health Policy to guarantee reliable supply of low-cost essential generic medicines at all levels of healthcare. Afolabi 1999 and 2013 examined the DRF at OAUTHC for its performance, pattern of inventory management, pricing system, and effectiveness in the provision of essential medicines at the facilities. The findings show that medicines were available on demand with adequate cost recovery. Patients were satisfied with the scheme, particularly the quality of medicines applied. Enhancing service quality in community pharmacies. Pharmapreneurship is an innovative idea, and it refers to pharmacy entrepreneurs who employ various management strategies and skills for effective delivery of pharmaceutical services across the practice settings. The associated skills of a pharmapreneur are key to the development of a range of health services in the community and hospital sectors. In view of the great potential obtainable from entrepreneurial education and the possibility of its economic advantage, Afolabi et al. 2016 examined the entrepreneurial traits among pharmacy undergraduates at Obafemi Awolowo University. And we identified factors that may influence their propensity towards self-employment. The results showed a high level of entrepreneurial traits among the students. With these findings, it was recommended to incorporate entrepreneurial studies in the pharmacy undergraduate curriculum and had been teaching them entrepreneurship since then. Furthermore, Jola Osho and Afolabi 2018 examined the pervasiveness of entrepreneurship orientation among community pharmacists in Nigeria. The constructs were found to vary significantly with demographic characteristics of the pharmacists and nature of their businesses. The object of locating a community pharmacy in a specific neighborhood is to provide pharmaceutical services and products at a profit. It is to provide destined for the need of the consumers. Therefore, the physical location should be able to support the type of pharmacy practice desired by the entrepreneur. Afolabi 1990 investigated the factors influencing the physical location of retail pharmacies in Nigeria and assessed these factors in line with theoretical expectations. The study showed the relevance of competing institutions and closeness to government hospitals or clinics. Alternatives to the sustenance of sole business ownership are joint ventures in form of partnership or limited liability companies. Afolabi et al. 1999 examined partnership patterns of community pharmacies in Nigeria. This was with a view to identifying factors that might help develop collaborative practice among the pharmacists. The study concluded that in Nigeria, community pharmacy practice was largely individualized, while the existing partnership was on the verge of total collapse due to personal biases, fear, and suspicions. Inventory control is a principal area of management concerns in any business. Inventory holding is necessary to run a business, but to tie up excessive capital in goods is not profitable due to various costs that may be incurred. Figure 7. Afolabi 1993 examined the procedure for medicine stock management at a hospital in Osun State. Management of inventory at the pharmacy was done manually, checking stock levels with the use of bin cards. There was neither a rigorous attempt at the application of inventory management model, nor of strict adherence to prompts on minimum stock or reorder level. Community pharmacies are easily accessible to the public, and in a bid to propose strategic options for quality management of these pharmacies, Inaugural et al. 2020 conducted the SWOT analysis of randomly selected community pharmacies and clients. The results showed the strengths were most obvious in the ease of access and good managerial skills. The community pharmacists exhibited marginal capacity to exploit opportunities and to mitigate threats and weaknesses. These factors limit service outcomes considerably. Closing reflections. My leadership experiences, services, and human capacity building. In a bid to enhance my academic and professional capability, I registered for a number of intensive training courses and obtained the certifications of the University of Washington in Seattle. Similarly, I attended executive leadership training at various institutions abroad. The International Women's Forum in Montreal, Canada, Harvard Business School, Boston, Massachusetts, USA, and the Women Leading Global Change program held at INSERT, the Business School for the World, Fontainebleau, France. The exposure was made possible by my selection into the IWF program and funded through sponsorship by the Carnegie Foundation. My candidature emerged from a very competitive pool of applicants from around the world. The 2010-2011 IWF Fellows class, to which I belong, comprised 32 participants from 12 nations: Brazil, Canada, Georgia, Hong Kong, Israel, Mexico, Nigeria, Singapore, South Africa, Sweden, and the United Kingdom and the USA. I was fortunate to be one of the 2 women of color selected from Africa. I appreciate Professor Fumi Togonu Bisquet, here seated, the then DVC, who believed in my academic prowess and brought the advert to my attention. Thank you, Ma, for advancing my career. These various exposures in professional development and executive leadership training groomed my teaching and administrative skills, some of which I have deployed successfully in the service of this university and other government establishments. I have served in various leadership positions at the Faculty of Pharmacy of this university. I was the student officer for 11 years, the acting head of the department on 2 occasions, the vice dean and substantive dean of the Faculty of Pharmacy, the premier school of pharmacy in Nigeria. I was also the chairman of the Pharmacy Council of Nigeria Committee of Deans of Pharmacy Schools in Nigeria. and a member of the PCN investigating panel. At the Obafemi Awolowo University Hospital Governing Council, I was the chairman of the establishment committee charged with strategic management functions of staff recruitment, promotions, and welfare. At the community level, I serve as a member of the following organs: Board of Trustees, Christway Ministries International; Board of Trustees, Ife Development Board; member of Council, All Souls Chapel, Ile-Ife; and a weekly radio presenter of the Hour of Praise. Furthermore, I was a visiting lecturer at the University of Ibadan, University College Belize in Central America, the Caribbean, and a WHO consultant as visiting professor at the University of Sierra Leone, Freetown. I'm a fellow of the West African Postgraduate College of Pharmacists, where I also teach and I supervise students on their thesis. And I'm also a fellow of the Leadership Foundation, Washington, D.C. Over the course of my academic journey in this university, I've successfully supervised 30 postgraduate dissertations, 6 of whom earned the fellowship of the West African Postgraduate College of Pharmacists. The others obtained MSc MPhil, while 3 of them have since concluded the PhD and making their marks in academics. Currently in the department, I'm supervising 6 students at various postgraduate programs, with 4 on the MSc MPhil and 2 on their PhD. I've served as external examiner in different faculties of pharmacy in Nigeria, with the privilege of reviewing promotion cases of colleagues to the professorial cadre at universities across various geopolitical zones of this country. As a lecturer, supervisor, and examiner of the WAPC, and I review for some high-impact academic journals in my field. My teaching career has produced successful healthcare professionals in different pharmacy practice settings, both in Nigeria and abroad. While in Sierra Leone, I successfully supervised 7 postgraduate students, some of whom are currently serving as heads of department and lecturers in their university. Others are in top positions in the country. In fact, one of the products is the current registrar of the Pharmacy Board of Sierra Leone. Furthermore, in August 2017, I led a 2-man team on ACE Project 031 Oak Park to train regional participants in Sierra Leone on the application of software in prescription processing and medicine inventory as an activity of the STEM project. This further enhanced the capacity of Sierra Leone's workforce in healthcare delivery. My odyssey in academic took me to international conferences, and on one of such visits, my IWF mentor, Prophet Kane, invited me to present a seminar at the American College of Obstetricians and Gynecologists in Washington, D.C. I owe much gratitude to God, my enabler, and to this university for providing me with the platform to have all these exposures and international recognition. Mr. Vice Chancellor, sir, my studies have provided empirical documentation of pharmacists' extended role in medicine management, far beyond counting, pouring, and sticking of labels to medication packages. Harnessing the untapped resources in a pharmacist. As I bring this lecture to a close, I wish to reiterate the untapped resources inherent in a pharmacist, irrespective of the practice setting. The healthcare system will benefit immensely with proper deployment of these resources through recognition of pharmacists' central role in medicine supply and interprofessional collaboration, creative deployment of pharmacy skills in terms of job enrichment and job enlargement in a conducive work environment, proactive engagement in pharmaceutical care and public health activities, developing pharmacists' entrepreneurial mindsets, recognitions and appreciations of my support system. Mr. Vice Chancellor, sir, I wish to submit that I dare not claim sole credit for the achievement that have culminated in the substance of this lecture. A succinct recap of my academic sojourn. It represents not only my dedication and hard work, but also the unwavering support of my family, friends, mentors, and all wishes who stood by me. Please permit me the following recognitions. My sincere appreciation to the Almighty God for this uncommon favor to be reckoned among the intellectuals of my day. Indeed, no one can do anything unless God in heaven allows it. I confess that this inaugural lecture is a lot doing, and it is marvelous in my eyes. I pay unalloyed attributes to my late parents, Pa Joseph Eluwole Adefisan, the grandson of Ojaja the First, from Balia Compound, Ilode, Ile-Ife, and Mami, Princess Bernice Oyedotun Adefisan, ni Ayola of Elewa ruling house, Ipetumodu. Education was of immense importance to my parents. I'm glad that today, my modest achievements in life could be traced to these devoted parents of blessed memory. Sincere gratitude to this citadel of learning, Great Ife, the crucible wherein I was molded and fashioned to become who I am today in my academic career. My intellectual growth, learning, teaching, and research were enabled by this university. For these unique privileges that OAU afforded me, I am highly indebted to her and the various administrations over the years of my sojourn here. Same appreciation goes to professors and other lecturers who trained me in the various faculties, units, and departments I ventured into. Professor T.O. Oyebisi supervised my PhD program, ably co-supervised by Professor W.O. Ero. Thank you very much for the thorough work, which I am very proud of to date. Thank you. My family of lineage is very dear to me. My sisters, Pharmacist Foluke Akinwome and Olutomi Babalola, along with their late husbands, made their homes a ready abode for me, and they were my economic backbone in the course of my studies. Thanks to my brothers and their spouses, Olusheyi and Tola, Oluyinka and Lola, whose homes are havens for me anytime I travel out of the country on academic trips or on vacation. Their deficits at home and diaspora, I love you all. To my dear husband, Venerable Professor Eyitayo Rufus Ifedayo Afolabi, my cheerleader and encourager, a die-hard academic and teacher of teachers, who encouraged me to veer into academics, very resolute in the face of difficult challenges along our path. He recognized the academic potentials in me, and he gave all the support, excusing the late hours I spent at my teaching reading desk and periods of absence from home as I traveled for academic conferences, seminars, and trainings. He never felt threatened by my achievements and exposures. We have been on this cell together for more than 40 years. Thank you immensely for this sacrifice of love, my academic mentor par excellence. I appreciate our children and their lovely young ones, Tosi Anoye, Efe Antolu, Ola and Sheyi. Thank you for your understanding all through my career journey. May you continue to enjoy the blessings of parenting. I'm highly favored with peace at the home front, and this is further engendered by my God-fearing and amiable in-laws, the Afolabi Boyibode family from Akure Oloyemekun, and our dear auntie, Mrs. Beatrice Ogunshuyi. Thanks for your love and support over the years. I'm honored to have in attendance my Christian leaders and distinguished elders of our community. The Diocesan of Ife is here seated to the glory of God. Bishops, general overseers, the general overseer of Christway Ministries is also this occasion. Chaplains and pastors of various cadres, distinguished elders of Ife land, members of the tripod, if a board of trustees to which I belong, if a development board, if a trust fund, and if academia. The palace is ably represented by these notable groups. To my Christian community, the Anglican Communion Dioceses of Ife and Akure, Christway Ministries, All Souls Chapel, Nigerian Christian Graduate Fellowship, thank you for the veritable platforms provided to develop my Christian calling in teaching, preaching, and intercession. For your prayers and brotherly love, which I will not trade for anything. To all my friends and acquaintances at home and abroad, my former students and mentees, thank you for your help in shaping my destiny. My distinguished audience here seated in the hall, and many others on the live streaming platform, thank you for your patience. Now unto the King, eternal, immortal, invisible, the only wise God, the honor and glory forever and ever. Thank you.
Certificate presentation. Obafemi Awolowo University Ile-Ife, certificate of presentation of inaugural lecture. This certifies that Margaret Olubunmi Afolabi, a professor of pharmacy administration in the Department of Clinical Pharmacy and Pharmacy Administration, Faculty of Pharmacy, Obafemi Awolowo University Ile-Ife, Nigeria, delivered the 405th inaugural lecture titled Beyond Counting, Pouring and Sticking, Managing Pharmacy Operations for Quality Service. On this day, September 9, 2025. Congratulations.
With the kind permission of the Vice Chancellor, I invite the spouse to join the wife.
If it had not been